Joining us now on the program is the Executive Director of Alliance Mobile Health, is Vince Waryas, joining us on the Oakland County Megacast. Vince, thank you for being with us today.
Good morning. Thank you for having me.
For those who are unfamiliar, what is Alliance Mobile Health? What services does it provide to communities in our local area?
Alliance Mobile Health is a private EMS provider for 7 cities in the Oakland County area. We provide emergency 911 response for various cities in the county. And we also do non-emergency transport work for patients that require medical treatment, such as dialysis and other medical procedures that are non-emergent.
So during the course of the pandemic, our EMS workers in local fire departments and local municipalities, as well as the private ones like yours, have faced a certain number of challenges in dealing with COVID-19 and more. Among those, what are some of those challenges that your organization has faced, and how have you overcome them?
Well, obviously, we're on the front line, and we respond to all calls. And one of the challenges that we have faced, obviously, is protection of both of our staff as well as the patients that we serve and we respond to and treat. So making sure that our units, our ambulances, our equipment are clean in between every single patient, protecting those patients from cross-contamination, as well as our staff that are on duty has been a challenge. And we've adopted several different new procedures to ensure that. And as a result, we've had very good success with that. Our units are sterilized every single day. They're wiped down and disinfected in between every single patient. We're practicing different types of techniques to preserve the health and well-being of our staff and other rescuers that arrive on scene. An example of that would be what we consider the dirty medic, clean medic process, where only one of the individuals on the team will actually make physical contact with a patient. But we start the assessment process at the door from a distance because a cough radius and sneeze radius can reach up to 12 feet. So we try to start that process as far away as we can and then work our way towards the patient. And eventually one will make contact and physically work with the patient while the other one provides a supporting role and stays as clean as possible to help any type of contamination back and forth. So there's been a number of challenges that we've had to adopt and change since the onset, but we're doing very well and we have been successful in that process.
Vince Waryas is with us, the Executive Director of Alliance Mobile Health on the Oakland County Megacast. So you provide EMS services for several municipalities around the local area, including the city of Troy, Michigan. And there's been an influx of need for emergency services during the COVID-19 pandemic between the virus and other issues that would be amounting anyways. Have you seen that your organization has had a need for more business from municipalities, maybe that you don't serve normally or through greater partnerships because of the circumstances of our times?
Yeah, yes and no. Generally speaking, during the peak of the pandemic that we experienced March, April-ish, even going into May, there have been a few cities in the Oakland County area that had been overwhelmed with call volume, requests for service and aid. And we work very well with the Emergency Operations Center here at Oakland County, as well as all of our city partners. We've got mutual aid agreements with all the surrounding cities. So anytime somebody gets overwhelmed with call volume, they reach out to each other, and good neighbors as we are, we always cross borders and we go into different areas as needed and help out. The city of Southfield, for example, experienced very high call volume there for a while, and we actually donated and staged a unit there 12 hours a day, 7 days a week for a couple weeks until they could get through that peak period. But overall, generally speaking, there's been a decrease in some call volume in some areas because of the fear factor that is out there, that people are a little bit leery about going into some hospitals right now because they're fearful of coming down with it if they don't already have it. So there has been that factor, but we seem to be responding back to that now, and things are getting a little bit back to normal from that perspective. There's not as much fear there, I think.
Has the recent spikes in COVID-19 cases been a cause for concern for you or for your staff in terms of continued safety going forward?
Oh, absolutely. There's no end to this just yet. We can't see a horizon yet where it doesn't exist. So There's been talk in many circles about this is the new norm, and in many respects that's true. I guess you could kind of look at it as a wake-up call that we're entering a new age of PPE and preparedness levels, if you will, from our perspective, that we have to kind of assume that every patient is infected until proven otherwise. So I think that we're seeing a new norm here as far as the way we approach things and how we're going to need to protect our patients as well as our staff moving forward.
Vince, are you concerned about being able to get the required supplies going forward? I know things have kind of leveled off right now, but if the longer this continues, those desperately needed PPE supplies, are you worried you won't be able to get them?
There's always going to be that fear because that's a factor that's outside of our control. We don't manufacture them. We don't have that capability. So availability of those items is always going to be of concern. But like you said, things are starting to level off and supplies have returned to a little bit more of a normal level. So we are capable of getting them. And we have been stocking up on those to prepare for any additional outbreaks that peak in numbers again so that we have them on hand. But what we also have been doing is we've been creative in our abilities to preserve some of that PPE, to reuse it, if you will. We've adopted some disinfecting techniques that maintain the integrity of the equipment as well as allow us to clean them in between uses so that they're what used to be not reusable items are somewhat reusable now. But we do try to keep that to a minimum, but we're utilizing information and techniques that we've acquired from, for example, Stanford University and various other research areas that have looked into ways of reusing and sterilizing this equipment without jeopardizing the integrity of its performance, if you will. So we're working with that, and that has been successful for us as well. So we're fairly confident that we'll be able to ride anything out that comes in the future, but at the same time, we're taking the steps necessary to prepare for that.
Vince Waryas with us. He's the executive director of Alliance Mobile Health on the Oakland County Megacast. We're in a bit of a heat wave here in southeastern Michigan over the last couple of weeks, and going forward, it looks like it's going to continue that way for a little while. Have you seen an uptick in recent days in terms of overheating issues and heat-related illnesses with people in the community?
Oh, absolutely. Anytime you get this type of a heat wave, you're going to see that. The elderly population is particularly susceptible to that because as you age, your body's ability to maintain temperature and cool itself is reduced, just as part of the natural aging process. So that tends to be the most susceptible population that we work with in that area. But yes, we are seeing some of that, and it is of concern. So obviously, if you don't need to be outside, don't go outside. Stay inside where it's air conditioned. Keep yourself safe, stay hydrated, drink lots of water. But while you're doing that, don't forget to get some electrolytes as well, because those are very important.
And for those that are experiencing these issues, what are some of the common reasons behind them experiencing these, and what are ways that you suggest and other emergency services workers suggest for them to prevent these issues going forward?
Are you referring to the heat-related
Yes.
issues?
Yes.
Obviously, like I just said, stay indoors unless you need to go outside and venture out. And if you do need to go outside and do work, for example, you need to cut your grass, do some lawn work, yard work, things like that. Do it in shifts where you're outside for maybe 20 minutes or a half hour at a time, and then go inside, take some time to cool off, drink lots of water, mix that up with Gatorade. Or something similar so that you get some electrolytes, because as you sweat, you're losing electrolytes as well. So simply drinking a lot of water is going to put yourself into a position where you may not have enough electrolytes to maintain cardiac function, muscular function. So you'll start cramping up. You might have some arrhythmias, things like that. So electrolytes are very important as well. But maintain hydration, get some electrolytes, and then maybe go in shifts so that way you can still do the work that's necessary outside, but at the same time, you're not putting yourself as much of a risk.
Can wearing a mask contribute to some of those issues?
Yeah, I would say it probably does, because if you think about the body's cooling system, you sweat most of the time, and that's how you get rid of excessive heat. But when you exhale, that air that's coming out is at your body temperature. So your normal body temperature is 98.7. So if that mask is on your face, it will kind of recirculate. So then you're breathing back in 98.7 degree air because they're kind of preheating it, if you will, in that combined space. So that's going to reduce the body's ability to cool itself to a certain degree.
Vince Waryas with us on the Oakland County MegaCast. He is the executive director of Alliance Mobile Health, providing EMS services to multiple municipalities in our local area. So Vince, going forward, what do you see as continuing to be some of those common health issues as we continue through the summer that we see normally and are going to see maybe more of during the coronavirus pandemic and as we transition later on into the fall?
Well, I think that the coronavirus pandemic is going to be here for quite some time. If you look at some of the models, they're predicting spikes in numbers coming in the fall. And I think that most of that is going to be as a result of us trying to get back to some level of normal as far as society goes, opening up businesses and allowing people to get back together, see each other again. So that's going to be expected, I guess. So the models I would expect are going to be somewhat accurate, but it'll be interesting to find out how close the numbers actually are going to be. As far as other things go, as people venture outside and they do more things, we always have the seasonal bee stings, and there's more trauma in the summertime because people are out, they're more active, things happen. There's more construction projects going on. People fall off roofs, off ladders, or get injured in those processes as well. So we typically see a little bit more trauma in the summertime as a result of the increased activity of people outside. In addition to that, there's always going hand in hand the heat-related issues, which we spoke about already. So if we practice some of those techniques of using short durations outside with frequent cooling and hydration, that will help prevent some of that. But just be aware of your surroundings, know what's going on around you, be careful while you're out there having fun. Jet ski accidents, drownings, swimming accidents, things like that are also on the rise in the summertime because water's warmer, the weather's nice, people are outside doing more activities. So recommendation is just be careful, be safe, and but try to have some fun. I think we've been cooped up long enough. Everybody's a little anxious to get outside. So as you do venture outside, just be cautious, be careful, and use good judgment.
Vince Waryas with us, the executive director of Alliance Mobile Health. Before we let you go, just a couple more minutes with you. Anything else you'd like to touch on today?
I think that everybody's doing a really good job for the most part. I think that overall, I think that there's a little bit of resistance now with wearing masks, but like we discussed before, the models are predicting that we are going to get a spike. What I would encourage people to do is just be mindful of that. And anytime you're in a public area, be mindful of wearing a mask, not just to protect you, but to protect everybody around you from you, because we've had several cases of people that are positive for COVID-19 that don't have any symptoms whatsoever. So even though you feel good and you don't have any symptoms, that doesn't mean you're not contagious. It doesn't mean you're not a carrier, if you will. So just be mindful of that so that you don't spread the disease unwillingly to other individuals. The susceptible population is anybody that has comorbidities, things COPD, emphysema, asthma, heart conditions, congestive heart failure, things like that, or a compromised immune system. And those people are going to have a much, much harder time overcoming the virus than a normal, healthy person would. So just be mindful of that. I know it's inconvenient, but it is something that we need to do to try and flatten that curve out so that we don't spread the virus unknowingly.
Well, Vince, thank you very much for being with us today.
You're very welcome. Thank you for having me.
Vince Waryas, the executive director of Alliance Mobile Health, with us on the Oakland County MegaCast.